There are many thyroid hormone replacement options if you need thyroid hormone for hypothyroidism. But oftentimes we've only heard about one, and that is called levothyroxine. And that was the only medication I was trained to use in school. And levothyroxine is a pill that you take every morning on an empty stomach. Thyroid hormone of any form needs to be taken on an empty stomach because it can bind to anything else in your stomach and then you won't absorb it as much. But levothyroxine is synthetic T3, and you can find it at any commercially available pharmacy for prescription. And levothyroxine is generic, meaning you can get it, there's going to be multiple manufacturers, and you might get a different manufacturer every time that you fill your prescription. What this means, and this is true of all generic medications that I'm aware of, it means that that prescription, say your prescription is for 50 micrograms, that prescription can either be 80% of that 50 micrograms containing that active ingredient, or it can be 120% of that active ingredient in your pill, or anywhere in between. So 1 month you may fill your prescription and it may be a lot less than you expect. And then the next month you can fill your prescription and it may be more than you expect. And it's hard to manage thyroid that way because some months you may feel worse than others. So something to know about that is if you're experiencing those symptoms, the best way to go is with branded medication, because branded medication does not have the variability like generic medication can. But the other piece to know about these generic medications, especially with thyroid, is you're going to get different types of fillers and binders in each pill depending on the manufacturer, which means that you could be getting gluten or soy or food dyes, and you may be sensitive or even allergic to gluten or soy or food dyes, and then you're taking it every single day. And so there are options as far as that synthetic T4 levothyroxine where you can take branded Thyroid. That's the cleanest form with the fewest fillers. So a lot of my celiac patients, if they're going to be on this type of thyroid hormone, do the best on Thyroid. That being said, you may be on levothyroxine for years and years and still have thyroid symptoms. You might feel like it's just not really helping you. It's not making you feel any better. And there could be a reason for that. Levothyroxine is synthetic T4, which means your body has to take that T4 and convert it to T3. And if you can't convert to T3, then you're not getting that active hormone that can help with your symptoms. And oftentimes, we're only checking levels of TSH, maybe T4, and we're not getting T3 checked, so we wouldn't even know that for sure. And so I wouldn't say most, but I'd say a good percentage of my patients, they do better on a different version of thyroid. Whether it be something called porcine or desiccated thyroid, or a thyroid combination of T3 and T4 that's derived synthetically. But let's talk about the desiccated thyroid first. So desiccated thyroid is taking the thyroid from a pig and grinding it up and sterilizing it and putting it into a capsule in different dosage forms, or a pill in different dosage forms. And the branded names for these that you'll see on the market right now are NP thyroid and Armour thyroid. NP is my favorite because it has fewer fillers and ingredients than Armour, and the manufacturing has been more predictable. There's been fewer recalls or dosage recalls in particular, and I just have more confidence that NP is going to be a more consistent product, and people seem to feel better on it. That being said, I do have plenty that are on Armour and doing well on it, and so those are a combination. So it's taking the full pig's thyroid, so you're getting T4, T3, and a little bit of T1 and T2 also. And so with that, you're getting a more complete thyroid product, and it may be affecting your symptoms or improving your symptoms more than just the plain T3 version. Some don't tolerate this as well, particularly if you're allergic or sensitive to pork, or if you have Hashimoto's, which is that autoimmune version of hypothyroid, where your body flares up and you can have an autoimmune reaction towards your thyroid, causing worsening of symptoms. And sometimes adding the porcine or desiccated thyroid to that can make symptoms worse. As far as other options are concerned, there's another option where I can write a prescription for T3, and T4, or a combination of those, to a compounding pharmacy where they can take the synthetic T3 and the synthetic T4, which are still bioidentical and similar to our own thyroid hormone, but they can put it in a capsule where we know that the ingredients are pure and clean, and I can write on the prescription, make this gluten-free and dye-free and soy-free and sugar-free and all the things so they don't put anything extra in there. And they can adjust the dosage exactly how I want it, the exact amount of micrograms of T4 and of T3. And that helps my patients, particularly those that are really sensitive to medications or have a lot of sensitivities, or their thyroid just really needs to be fine-tuned, and every little tiny adjustment makes a big difference for them. And you can't do tiny adjustments on the regular prescriptions that we send to a pharmacy. They can also, the compounding pharmacies can also compound versions of NP or Armour thyroid into, basically they take the porcine compounded equivalent and they can make it into doses that you need and put it into capsule form and make those hypoallergenic too. So there are a lot of ways for me to prescribe and for you to take thyroid hormone. And it's important you know those ways so that you can, especially if you're feeling bad or one thing's not working, to just know your options and know that maybe you're on something that is not hitting the mark for you.